Hey guys, Mike here from nursing.com. In today's video, we're going to talk about the categories that you really should focus on when you're getting ready for the NCLEX. Now, why are these the categories? Well, it's because they're the ones that hold the most weight. Four that I like to focus on are management of care, safety and infection control, pharmacological and parenteral therapies, and physiological adaptations. And when I get into these a little bit, you're going to see why this is most of what we do. Got my notes, and you're going to have to forgive me because there's no way I'm remembering all this stuff. So when we talk about management of care, the kind of things that they're going to talk about are like advanced directives, advocacy, case management, clients' rights, confidentiality, continuity of care, priorities, ethical practice. Ethics is a big one that's going to come up a lot in your career, so you might want to focus on that. IT, information technology, legal rights. Something tells me HIPAA is going to come up in that. Oh, performance improvement, QI. There's a lot of stuff on that. And then referrals, if you're referring to like other docs or other agencies. So that's all in that category. So then we get into safety and infection control. This is stuff that, like when we talked about in other videos about educated guesses, a lot of that stuff is here. Things like accident and injury prevention, the emergency response plan. Now, there may not be a specific one for your facility. I take that back. If there is a specific one for your facility, forget about it. They're not going to ask about your facility. They're going to ask about this in general. So in general, what would be part of an emergency response plan? Like getting people out, evacuating, putting out fires, things like that. Ergonomic principles, hazmat, that's a good one. Home safety, incident reports. Okay, every facility has that. Safe use of equipment, a security plan. Ooh, nobody should get these wrong. Standard precautions. If any of you in the land of COVID and the stuff you just went through in nursing school can't get the questions on standard precautions right, come on, guys. That's easy stuff. There are some questions that are gimmies. Things on PPE, those are gimme questions, guys. Those are ones you should absolutely not have any problem with. And then use of restraints or safety devices. That's also one of those that isn't too tough. I mean, there are times we can use restraints, times we can't. You guys should know those. Pharmacological and parenteral therapies. It's like IV stuff. So this is a lot about meds, adverse effects, contraindications, side effects, interactions. They're going to ask about things like that. They're asking about blood, how we give blood. Dosage calculations. There may be a couple. Don't go crazy. You know those. You guys had to do dosage calculation tests, I think. I mean, I know I had to back in the day. Med administration, obviously. IV therapies. Pharmacological pain management. That's a big one. And I will tell you, I'm assuming, I hope, but one of the things they always like to talk about when they ask pain management questions is things before pharmacology, things before meds, distraction, meditation, things like that. Anything you can do before you hit them with the narcs, right? TPN, total parenteral nutrition. That's about it in there. And then we get into physiological adaptations. And this is kind of like the basic stuff on how we care for our patients in the hospital. So a lot of stuff on alterations in body systems. I'm not going to go into all of it, but there's a lot of it if you look at that. Fluid and electrolyte imbalances, hemodynamics, illness management. Right, this is being a nurse, right? Medical emergencies, patho, a little bit, not too much patho. And then unexpected responses to therapies. So what happens if you give something and something bad happens, which never happens. Okay, it does happen. So those are kind of the four areas that I would focus on. And the reason being, those are the four that have the most percentage of questions. There are other areas, but for me, I'm going to study the area that's got 21% of questions as opposed to 6%. If I can get that 21% and guess on the 6%, the odds are I'm going to pass the test. All right, so a little bit of info for you guys. Check out some of our other videos. You guys are all going to kill this test. I know it. You're going to do great. Hey, guys. So I hope this video helps you in your nursing journey. Now go out, be your best self today, and as always, happy nursing.